And good morning. I'm Dr. Deuk Majan with the Deuk Spine Institute. We're here today with a patient from Canada who's traveled here for back pain to get his back pain cured. And turns out he's got back pain coming from his facet joints. He also had pain coming from his SI joints and his discs and his piriformis muscles. So we're going to fix all of it today. We've just completed surgery on the disc, and now we're going to shift gears and go to the facet joints at L5-S1 along with the SI joint. So the first thing I'm going to do is identify where the pain nerve is on the transverse process of L5. This is the right side. I have to move medially to where that pain nerve is. I can feel the bone with my probe, and my goal is to destroy the pain nerve itself at the, he actually has a little Bertolodi syndrome right there. You guys see that? Where his L5 transverse process articulates with the sacrum.
Yes, we do.
All right, so my probe tip is in the perfect spot. I think Jordan is sleeping today. Did they overwork you yesterday, Jordan? Did you show the Bertolodis? Here we go. Good job, Jordan. All right. Oh boy. Did they overwork you yesterday, Jordan? You need a vacation? Huh? What? So you have no excuse? All right, let's show our audience how we treat SI joint pain. And actually, let's start with facet joint pain.
Copy that.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. We've just completed our right SI joint DPR, rhizotomy, killing 5 pain nerves to the joint, as well as the right L5-S1 facet, which was also painful, full of arthritis. And we're going to move on to the left sacroiliac joint and left L5-S1 facet joint. Sean, I'll take the question in a moment, but first I want to, hold on, Sean. I want to, I think this is good right here. Yeah, I want to share with our audience our little animation on how we diagnose and fix facet joint pain. I don't think we've done that, right? Or did you just do that?
Just the facets.
All right, so let's do the SI joint then,
Copy that.
since we're working on both.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from our video how we can actually cure the SI joint pain by, man, he's got some scoliosis, huh? Right here, shot. Go ahead and numb and the SI joint gets arthritis from injury, old injury. And then it starts to hurt, and it doesn't stop hurting. And the other alternative treatments are shots and fusion, but they don't work. Fusion is highly invasive, dangerous, and been proven not to work. Go ahead. So we needed a solution for the SI joint that would get rid of the pain permanently, and that's when we applied what we already knew to work, which is the Deuk plasma rhizotomy. Sean, we applied that to the SI joint, and lo and behold, we were able to cure SI joint pain with our Deuk plasma rhizotomy. So we've been doing Deuk plasma rhizotomy for SI joint now for years, and our cure rate is pretty close to 100%. It's about 99. All right, that's. Any questions?
Yes, we have a question coming from Lanu on YouTube.
No, Lanu's not allowed to ask any more questions.
No, he's joking.
That looks good right there, huh, Jordan?
Asking, I often argue with patients wearing back braces. What is the best way to tell them that back braces is only a temporary solution?
Yeah, back brace is not a solution at all. As a matter of fact, back brace is going to weaken the muscles in your back even more. We never, ever recommend a back brace for back pain because it is the wrong treatment for back pain. It's only going to make you worse. But what I've learned, Lanu, is that in life, some people just won't listen. You can't force them to listen. All you can do is try to show them the way. Do the best you can. And then if you can't do any better than that, so be it. You've done the best you can, right? I have given up on trying to change everybody's mind. I'm only going to change the minds of the people who are wanting to have a better life. I need another one. So I can't change everybody's minds. No matter how right you are, the world is round. I don't know if you know that, but this world that we live in is round. And there are people who believe that this world is flat. And even today in 2025, and when I heard about that, I literally laughed my heart out. But at first I thought, what am I missing here? And then I realized I'm not missing anything. It's just there's people who choose to refuse to believe the truth. And you can't fix those people. And honestly, maybe we shouldn't be fixing those people. Maybe you just leave them alone and let them believe what they want to believe. Okay, you can see the patient had a hip replacement. We're going to move on to our piriformis. So we're going to end the stream. We're going to go to bilateral piriformis muscle release, and we'll start the surgery then.